Good afternoon. We're going to start with a quick rundown on our COVID numbers and talk a bit about vaccines. Yesterday, the Department of Public Health reported 4,985 new confirmed cases. That was on 92,627 tests. We've now conducted over 9.9 million tests here in Massachusetts. 1,871 individuals are being treated in the hospital for COVID, and 383 are in the ICU. Phase 1 of our vaccine distribution plan is underway, with clinical and non-clinical healthcare workers providing direct and COVID-facing care being vaccinated with the first dose. This week, the first dose of the Pfizer vaccines were distributed in Massachusetts. In total, 59,475 doses of the vaccine were distributed to hospitals. On Monday, 4 hospitals received shipments. On Tuesday, 17 additional hospitals received shipments. On Wednesday, the State Public Health Lab received 19,050 doses of the vaccine and began distributing these vaccines to more than 10 smaller hospitals, with more distributions planned throughout the weekend. Hospitals have begun immunizing their staff this week. The first staff vaccination was at Tufts Medical Center, and 66 COVID healthcare workers were vaccinated that first day. So far, over 6,200 vaccinations have been administered across the Commonwealth. The doctors, nurses, and medical workers receiving these first doses are also the same people who, as we all know, have been battling COVID and caring for our residents since this all began. We think it's great to be among the first, that they are among the first to receive the vaccine. It not only protects them, but it also protects the people that they take care of. It protects their families, and it's a huge step toward getting back to something a little more normal. And this afternoon, the first healthcare support worker at a state-run hospital will be vaccinated. Sofal Soth, an Environmental Services Department supervisor at the Shattuck Hospital, received a vaccination this morning. Hospitals have developed their own plans to vaccinate their workers. They know their staffs the best and are developing these rollout plans on their individual circumstances. We expect hospitals to continue to immunize their eligible staff members over the next few weeks. And they will continue to report their vaccination data to DPH, and so far all the hospitals are reporting overwhelming acceptance from doctors, nurses, and medical workers who are eligible to be vaccinated. This isn't really surprising. These folks know more than almost anybody else how much trouble this particular virus can cause, and these folks have been through it all and have quite a sense, I think, more than many, about why this is such an important part of getting back to normal. The DPH is on track to launch a public-facing dashboard with immunization data on it next Thursday. This will be posted on a weekly basis, and the dashboard will include information like total doses delivered and administered, as well as geographic information. Next, long-term care facilities will begin vaccinating starting the week of December 28th. CVS and Walgreens are set up to begin those vaccinations in those facilities under the CDC's long-term care pharmacy partnership program. Their teams will travel to facilities to administer vaccines to residents and staff over several days for each facility. And those doses will come from the state's second Pfizer allocation. Many people heard the news yesterday that the federal government had announced that smaller quantities of vaccine would be delivered to states in this first wave, including Massachusetts. The command center was informed by the feds that our next few allocations of doses from Pfizer in Massachusetts, we will expect to receive 42,900 doses instead of the just over 59,000 doses that we anticipated. Many other states have received similar notifications from the feds about decreases in their orders. At this time, it's not clear to us why the shipment amounts have been adjusted. We're certainly frustrated that we won't be receiving the amount that we expected in the first wave, and are working to get clarity on what this means, why it happens, and how that bump will be dealt with along the way. And we understand that while the distribution of vaccines is a massive undertaking, we'll be ready to work through our plan to ensure that the residents of Massachusetts are fully vaccinated as quickly and as safely as possible when supply becomes available. It's important to remember that this change in delivery plans will just result in a slight delay in the overall process, and it's not clear yet if it will affect the timelines we've discussed in any meaningful way. The Command Center and DPH have been working to continue developing and implementing the rollout of the vaccine to other priority groups in anticipation of the arrival of additional vaccines from Moderna. First responders will be the next priority group to be vaccinated after COVID-facing healthcare workers and long-term care facilities. And the state has also put in an order for 120,000 first doses of the Moderna vaccine, which did receive. Did it get it yesterday or is it getting it today? Today. Which should receive its emergency use authorization from the FDA today. And we expect to start receiving those doses early next week. As we continue to move forward, we'll continue to provide the latest information that we have available to the public on this process. And residents can obviously learn more about this by talking to their doctor about the vaccine or by visiting mass.gov/COVID vaccine. Before I close, I want to mention a bill that we're filing today to ensure that we continue to provide unemployment benefits for those who are out of work during these unprecedented times, and to provide relief for the Commonwealth's employers as well. As we've said before, the Commonwealth borrowed funds from the federal government to keep the Unemployment Trust Fund at a level that can sustain payments to the thousands of Massachusetts workers who lost their jobs through no fault of their own due to this crisis. At the same time, the sheer volume of unemployment claimants means that under current circumstances, UI rates, the rate that's actually paid by employers, would automatically be scheduled to increase at the beginning of next year. The legislation we're filing today proposes to do two things. First, we want to freeze the unemployment insurance contribution rates for employers, which will provide immediate and important relief to all businesses across the Commonwealth. Second, we want to enable the Commonwealth to issue special obligation bonds for the purpose of repaying the federal funds we received this year to keep the UI Trust Fund solvent. Issuing the bonds to pay back these federal funds will save money for both the Commonwealth and its employers and ensure that we can continue to pay unemployment benefits to those who need them. And we look forward to working with our legislative colleagues to pass this legislation to support continued unemployment benefits for Massachusetts workers and critical relief for our employer community as well. It's obvious, by the way, that the arrival of the first vaccines is a huge step toward restoring what we might call normal around here. I'm sure that the videos and the photos of healthcare workers being vaccinated across the country have given hope to many that we are, in fact, turning a corner. There's obviously a light out there at the end of the tunnel, but we all need to hold on a little longer, and we need to keep doing all the things we've talked about that are effective to fight the virus in the months ahead. And people already know what it is they need to do. Wear a mask, don't gather in groups, stay home except if you need to go to work or school or the store, and recognize and understand that everybody has been touched by this virus in one way or another. And the best thing we can do at this point in time to maintain, control, and manage the spread is to do the things that we all know reduce the spread in the first place. We'll be back to talk a little more about that next week as we head into the week of the holiday season here. But mostly, what I want everybody to take away from this is how important the role that you play in how this virus affects you, your family, your friends, and your neighbors can be in helping us deal with the spread in the first place. And with that, I'll turn it over to Secretary Sudders.
Governor, Lieutenant Governor, good afternoon, everyone. As the Governor indicated, we were informed by the federal government yesterday that the next few allocations of doses from Pfizer will be short of what the Commonwealth had been expecting. The Department of Public Health now expects to receive 145,000, a little bit more than 145,000 doses of the Pfizer vaccine by the end of December, a number that has been reduced from 180,000. So it's about a 20% decline. As we've said from the start, however, the vaccine process, much like the pandemic itself, is fast-moving and ever-changing, and we will continue to pivot as necessary. The Massachusetts COVID-19 Vaccine Safety and Efficacy Evaluation Task Force, which is independent of government, following its review of the safety and efficacy data for the Pfizer BioNTech COVID-19 vaccine, otherwise known as the Pfizer vaccine, unanimously recommends that the Commonwealth deploy the Pfizer vaccine under the EUA as per FDA guidance, as per a state independent group. More information on their evaluation can be found online at mass.gov's Preparing for a COVID Vaccine page. To ensure that we have enough qualified vaccinators, today we have extended the authorized list to include emergency medical technicians, emergency services personnel, nursing, and medical students. The public health order and guidance are posted now. Again, it's to extend our qualified vaccinators. As the governor indicated, long-term care facilities will begin vaccinations the week of December 28th, followed then by our first responders. We are scouting out potential sites and partnering with providers to stand up mass vaccination sites across the Commonwealth. We're aiming to launch the first few in January. First responders will be able to use these sites, among others. Some local boards of health, hospitals, and medical providers have also stepped up to volunteer to support vaccinating our first responders. First responders will receive information about where they can obtain the vaccine via our website and from their employers in the next few weeks. 24/7 congregate care programs, including shelters, correctional facilities, and human services group homes, and for their staff and the rest of the healthcare system will follow in order. There are, of course, many questions on prioritization. Where does a particular occupation or group fit into our three phases? First, I want to emphasize that the list of groups on the phase graphics are in order of priority. So groups at the top are first, obviously our COVID-facing healthcare workers. As we work our way through the list, we will be providing specific information for your group on where and how to get vaccinated. Twice a week, in response to questions about specific position types, we will post clarifications on the mass.gov/vaccine website, Tuesdays and Thursdays. Our work is centered on the equitable distribution of the vaccine, of course. Our plan calls for allocating an additional 20% of the vaccine to providers and communities with high social vulnerability and a disproportionate burden of COVID-19, a calculation that is made based on updated U.S. Census data and coronavirus cases per capita on the city and town level. Changing gears, we are still recruiting staff for our two field hospitals, the DCU Center, as well as our Lowell site, which is coming online in the next few weeks. I am particularly calling out for nurses and patient care associates to apply for this very important work at our field hospitals. Please visit lowellgeneralresponse.com or umassmemorialresponse.com. We need you. And finally, this week, I'm proud to announce that Massachusetts became the first state in the country to receive federal approval to continue the pandemic EBT, known as PEBT, benefits for the entire 2021 school year. This was a result of very close work between the Department of Transitional Assistance, the Department of Elementary and Secondary Education, and local school districts. To date, the pandemic EBT has provided over $253 million in federal food assistance to more than 530 students across the state. By the end of December, these more than 500,000 eligible families will receive PEBT benefits to cover October and November school days in one special payment. It's important as we continue to address food insecurity in Massachusetts. And for more information, you can visit mapebt.org. Thank you. And as the governor said, as we go into the holidays, it's important for all of us to continue to use all the public health measures that we know work. Wash your hands, keep your distance, stay home if you're sick, and keep your groups very, very small. And with that, I'll turn it back to the governor.
Questions?
Pfizer says it has millions of doses ready to go in warehouses, and it's just waiting for shipment instructions. So is someone dropping the ball here? And you worked in healthcare a long time. Is someone dropping the ball here?
Well, I think we've said for a couple of weeks now that we thought the initial rollout would be bumpy. And I think the task that is at hand here, which is the distribution ultimately of hundreds of millions of two-dose vaccines, is a big one. And I view this to some extent as part of the lumpiness that comes with starting a program like this. And once the flywheel starts to really roll, I anticipate that we'll probably end up receiving every bit as much as we were expecting to receive, even if the deadlines and the transactions early on tend to be a little different.
So do you think it's the federal government that is responsible for this snafu?
I don't, we'll have a call next week with the feds, and I'm sure we'll get more answers then. But remember, we said we've given you guidance on when we think certain things were going to happen between now and April, okay? And we also said that we expected early on some of this might be a little lumpy or a little bumpy. And given, again, the size of the task and the magnitude of the undertaking, we expected and anticipated it would be a little bumpy, and it is. But that's not, in the grand scheme of things, something we're particularly worried about.
Are you concerned that people who really need this in the middle of a surge, the people who are most vulnerable, won't get it because of this?
Well, keep in mind that everybody's got to get 2 doses, right? So what this means is the process through which people get those 2 doses might lag by a week or so. I would love to be able to say that it's not going to, but on the margin, this will make a difference for some people. But in the grand scheme of things, we still believe that by the time you get into the first couple of months of next year, we'll have more than enough vaccine to serve the people we're supposed to serve on the time frames that we're supposed to serve them.
Governor, do you think that the people who got the first dose, some of the healthcare workers, could be delayed in getting the second because of this announcement?
No, I don't. I think people will get their doses pretty much. They'll get their second doses on schedule, and the thing is set up to make sure that we do it that way.
Governor, we're getting reports from hospitals that the sign-up systems are overwhelmed, that these COVID-facing clinicians cannot get slots. Have you guys heard that? And if so, what is the state doing? Can you do anything without 4 doses?
Well, I'll start on that, but I'll let Secretary Sudders follow up on it. There were a lot of surveys out there that said as many as half the people that would be eligible for this vaccine when it first became available wouldn't sign up, right? And that was the concern that I think we and a lot of other people had. And we have long conversations with our colleagues in the healthcare world about whether or not people would want to get the vaccine, who would want to be first, that type of thing. And I think in some respects, the fact that there has been an overwhelmingly positive response from the folks who work in the healthcare world and who qualify for this straight out of the gate is a positive development. I don't view that as a negative development at all. It's a big statement about the fact that a lot of the folks who've been closest to this issue from the beginning are excited by the opportunity to receive the vaccination. This is a positive development in many respects. I mean, most of them had no idea. I mean, most of the providers had no idea whether people were going to leap at this or not. And I think the fact that the vast majority of the folks who work for these organizations and have those frontline jobs on the COVID-facing part of their operations want to get vaccinated is a positive. But I don't think it's going to have an impact. I mean, would we love to be able to do everybody once? Yes. But we all assumed this was going to be a staged rollout from the beginning based on the guidance and the information that we got from the feds.
Do you think it's fair the way it's being distributed? It seems like states are kind of competing against each other. Some are getting the information you guys got yesterday.
I think that rollout is just based on per capita data, right? It's just a straight per capita allocation. There are a lot of different ways you could have done it, right? I mean, they could have done it based, and they talked about this on one of the calls. And I think where they landed in the end was that the simplest way for them to distribute vaccine would be to do it on a per capita basis. Now, states that have been hit harder than others might have said, you know, that we should be farther up on the list than other states. But then you had other states who said, but our surge came later, and therefore we're right in the middle of it now, and therefore, you know, we should get priority. And then other people said, well, it depends upon the nature of the socioeconomic makeup of your population. I mean, there was a lot of back and forth about sort of how to define equity with respect to how the feds were going to distribute this, and the place they landed was per capita, which is not that unusual. There are lots of things that get distributed by the feds on a per capita basis.
Some people were worried that there'd be some line cutting, so to speak. I know that you guys have talked from the original rollout, but do you think there's enough in place to make sure that, or even people from other states who don't, you know, we're getting maybe more, so somebody from another state comes to our state, you know, as far as providing.
I don't. Do you want to? I don't think that's going. You should speak to that, but I don't think that's I don't think that's going to be an issue.
People were worried about this line cutting mentality. Yeah. Somebody who's well off might get the vaccine before somebody doesn't.
You know, we are doing our best to ensure that we follow the process that was outlined by the Vaccine Advisory Board. All the providers, as I said before, have to attest that they're following the guidelines, and the patients are registered, so you have to, you know, through your providers and the like. So I believe like this first rollout is rolling out the way we wanted it to. Obviously, the fact that Mass General Hospital and Tufts, you know, enrollment system crashed was, you know, while unfortunate, it actually sort of demonstrated that fact that so many of their workers wanted to sign up for the vaccine. So, you know, we're watching it obviously very carefully, but we are pleased at this point of the enthusiasm of healthcare workers and support staff. I really want to be clear that when we rolled out the COVID-facing first tranche of COVID-facing healthcare, it was doctors, nurses, techs, environmental services staff, dietary staff, who also are very much COVID-facing workers. So, you know, a few days in, you know, other than a snowstorm, we're feeling like, you know, we're heading in the right direction. Yeah.
If there are delays, do you know who that would fall on as a result of the short and expected doses? Do you know who would that fall on, the healthcare workers or the long-term care facilities or the first responders?
So as we are rolling this out, the prioritizations, right, are in each phase. And our second phase of Pfizer is going to long-term care. So what it would probably mean is just a further healthcare workers would just take a few weeks longer before we would then get to sort of emergency responders. Because the second dose, our second allocation of the Pfizer vaccine is for long-term care. So that's why that's starting the week of December 28th. That's gone. Yeah. Right.
And the fact that we're finding out that there are 6 doses per vial as opposed to the expected 5, does that help? Does it make up the difference?
So as we have been discovering that, as vaccinators have been discovering, you get 5 or 6 per vial, it's obviously good news, which we had not, you know, no one had really been anticipating that. So that could catch it up a little bit. But we are thinking, as the governor said, you know, we're assuming Moderna being approved. We'll have Moderna coming in Massachusetts very soon. And hopefully this is just, you know, the beginning, you know, a beginning lumpy bump of rolling out vaccines across the Commonwealth.
Secretary,
I'm sorry, what?
Sorry, just a question about testing.
Testing.
I had heard that some of the stop the spread sites were moving to appointment only. I know that some of the ones run by Project Beacon are appointment only. Is that a thing that's going to happen across all the stop the spread sites, or is that just certain sites?
No, just sort of certain sites. As you know, the Project Beacon pilot in Revere has been very successful on many fronts. One is it's very cost effective for us. So in the initial when we rolled out Stop the Spread testing, it was a cost of about $144 per test, and Project Beacon is about $62 per test. And it's an online, as you know, it's an online, so you know how it works. And individuals who use it It's like a 5-minute experience, and you get your test results back in like 12 to 16 hours. I mean, it has been, and we've been able to figure out how to account for no-shows, so which is why it's been highly effective. So we've been rolling out Project Beacon sites in response to the positive response, the positive reaction to it, and it's very cost-effective for the Commonwealth as well. We have to have some walking capacity. So we've done 2 things. So in like Lawrence, in most of the host communities where we have Stop the Spread, it's more than one location for exactly that reason, to be able to accommodate both walk-ins as well as appointments. And we also pushed out, as you know, distributed the Abbott Binex, about 150,000 Abbott Binex community hospitals and to community health centers to also accommodate walk-ins and the like. So, but the Project Beacon sites really expanded as a result of really consumer experience.
Secretary, I know the governor had mentioned that it's not clear whether or not this situation with the vaccine will affect timelines in a meaningful way. When will you have a better idea of when it could potentially affect timelines in a meaningful way? If these lumps continue, how much longer will that?
Well, so a couple things, right? Pfizer was the first, that was last week approved. We have Moderna, should be approved. It may be as we're in the middle of this press conference. I don't know when it's going to be approved, right? So we have Moderna. So we'll then have 2 vaccines available to us. So that helps. I would say, we don't speculate. If there were continued decreases in the Pfizer allocation, that would obviously be of concern to us. A month from now, if we see that what we expected to be 59,000 per allocation and that decreases continuously, that would be a concern to us, because then that sort of pushes things out. But at this point, we're seeing this as the beginning of, as the governor said, the beginning of what is going to be a several month period of vaccinating people in the Commonwealth. So, as the governor said, frustrated, a little disappointed, but this is week 1, which is going to be a multi-week process of vaccinating people in Massachusetts.
Secretary, for first responders, how many sites, vaccination sites are expected to be set up for them, and how far do you expect someone to travel to get this done?
So, we want to make vaccines as accessible and easy for people to in order to be vaccinated. So we're looking at a number of things. One is we are definitely looking to set up a number of mass vaccination sites, not just for first responders, but then for other groups, including the general population. And I'm actually, we have a lot of people actually offering physical locations. So then it's then matching, right, the medical providers, the vaccinators with those sites in order to do it, as well as local boards of health, employers who can be vaccinators can do it. So what I'd say to you is in like a couple of weeks, we will have on the website where our first responders can get vaccinated. And obviously, closer to where they work, the better it is for them and the better it is for us.
And just to clarify, for those who work second or third shift, are there plans to accommodate them as well if they might not be able to go during normal business hours?
As we have done with testing, is to often have hours very early in the morning so that people coming off of like third shifts. So I'm not as worried about people on second shift. It is more individuals who work the 11 to 7 shift that you want to make sure that at least as people are coming off shift, right, you can get vaccinated and go home and sleep. So I'm quite aware of making sure we have accessibility for all 3 shifts for people.
Governor, we saw Vice President Pence today publicly take a vaccine. You mentioned to us that you are 64, not 65.
Thanks for reminding me, John. I appreciate that.
And looking good. But would you consider doing a public vaccination to set an example to the people of Massachusetts that it's safe, effective, and we should do it?
We talked a little bit about the idea of doing a public vaccination, and I think we came to the conclusion that there are plenty of people who can do public vaccinations who would be a lot more important than me. And I would argue that the folks who work in our public health hospitals who've gotten vaccinated fall into that category. The folks who work at our hospitals generally and in our healthcare system generally, getting vaccinated is a lot more important than me, and frankly, a lot more meaningful, I think, to most people. I don't remember where, we saw some survey that basically said that elected public officials, you know, on a list of people you would be most likely to believe with respect to the value of a vaccine and a safety and efficacy and all the rest, if the list started up here with like Dr. Fauci, you know, elected officials were down here somewhere. So I don't really think of myself as somebody who should get vaccinated before I actually qualify as an individual, and I don't think me getting vaccinated publicly would make any difference relative to a lot of the other people who I think people would take far more seriously and appreciate seeing them get vaccinated first.
Governor,
Governor, more than half the cities and counties in the state are now in high risk of transmission, according to
Say again?
more than half the cities and counties in the state are now in high risk for transmission, according to the weekly guidelines. Does that mean you're considering any more restrictions, rollbacks, like the Greater Boston rollback? What are you thinking about that?
Well, we've been talking for a while about the fact that the most important thing people need to do is recognize and understand the role of informal gatherings where no one wears masks, there are no rules, and the virus spreads. That remains, for all intents and purposes, our greatest challenge. I think a lot of you were here when we showed you what happened 7 to 14 days after Thanksgiving with respect to both our positive test rates and our hospitalization data. There's no question that the informal gathering that took place, and I get how important these are to people, around Thanksgiving, had a big impact on our test rates and a big impact on our hospitalizations. And for all those who want to get back to the normal that we all want so desperately to get back to, the biggest thing people need to understand is that Thanksgiving set us back, all right? Thanksgiving, that informal holiday where lots and lots of people gathered for long periods of time without masks together, had a big impact on what happened to our positive test rates, our number of cases, and our hospitalizations. We have a whole slew of opportunities coming up over the course of the next few weeks in this holiday season where people will have to make private, personal choices about this. And I think those are hard, private, personal choices, which is why we talk about them. But when people think about the decisions they need to make, they should be thinking about them in the context of Thanksgiving and all that data associated with household transmission, which is not just true here. It's what's driving the caseload if you talk to the folks in Rhode Island. It's what's driving the caseload if you talk to the folks in New Hampshire. I mean, I talk to the governors in the Midwest. Point blank, they say that's the primary thing that's been driving cases in the Midwest. And that is something people actually have the ability to do something about. And if you are going to spend time with people outside your immediate household, and I hope you don't, but if you do, keep your distance, wear a mask, follow the protocols. Because you're not necessarily going to be in a position to know where that person's been, who they've been with. And I get the fact that no one wants to think that their friends or their neighbors could possibly be the source of transmission. But I can't tell you how many times in the past couple of months somebody I know has told me a story about how they got it, and it all goes back every single time to some informal gathering where nobody wore masks, nobody kept their distance, and the virus spread. I mean, it's pretty common at this point that that's where a big piece of this is coming from. So that's my advice.
Governor, are you at all troubled by what's going on in the House with the Speaker apparently preparing to hand off the job to a trusted lieutenant?
So, as I understand it at this point, I did speak briefly to the Speaker this morning, who called to tell me that he was filing an ethics report with respect to conversations he's having with Northeastern. I do know at this point there are at least two folks who have expressed interest in succeeding him, Representative Russell Holmes and Representative Ron Mariano. We've obviously worked a lot with both of them. Ron Mariano, for all intents and purposes, is probably the key voice in the House on healthcare issues, and we've spent a lot of time with him talking about healthcare over the last 5 years. And Representative Holmes is somebody we've worked with on housing issues, on economic development issues, on transportation issues, and racial and criminal justice issues. I think if I have a concern about this, and this is very much up to the House to figure out how they want to handle this, it would be that we're toward the end of the session and there's a whole bunch of pretty important pieces of legislation kicking around, and I really hope that people find a way to focus on trying to get those through the process and to our desk so that we can sign them. This UI bill that we're talking about today, we could do this in January or February or March, but if you want to send a really big and positive signal to employees and to people who are out of work and to employers, this would be an incredibly positive message to send, because it limits the increase in unemployment exposure to workers, and it also limits the hit financially that would be associated with employers come January who are spending a lot of time thinking and worrying about that. Same goes with the stuff we talked about the other day, the economic development bill, the transportation bond bill, the climate bill, the police bill. I mean, there's a lot there, and I hope that in the midst of whatever it is that's going to happen on this issue here, that agenda, which is still very much alive, real, and needs to get done sometime between now and January 4th, gets done.
Did you ask the speaker to stay on until the end of the session?
I didn't. From my point of view, those are really personal decisions, and people should make whatever they think is the right decision given the circumstances. And I basically just thanked him for the call, and that was that.
With the unemployment bill, can you just sort of help explain for the average person who might not understand why it's important to enable the state to repay some of the borrowed money, and why the other provisions might be important for business?
Yeah, okay. If you borrow money from the federal government through the traditional process to fund your unemployment insurance system, both the rules associated with the interest rate you pay, the cost of the money you borrow, and the time frame associated with how you pay it back are different and much more onerous to the Commonwealth, to the Unemployment Trust Fund, to the employer community than the private market. I mean, at this point in time, interest rates in the private market are incredibly low. The payback schedules are different than they would be if you just borrowed the money from the feds. And this just ends up being a much less expensive way for the Commonwealth collecting unemployment payments from employers to continue to finance our unemployment insurance system on a go-forward basis. And the fact that it's so much less expensive means people get their benefits that they're entitled to, and employers, in the midst of a terrible, terrible time for so many of them, continue to pay what they pay now and don't get a big monthly increase that could be hundreds of dollars per employee, quarterly increase that would come out of them.
With business owners, a lot of them are also concerned about dealing with other increases, like
Sure.
the minimum wage. Some of
Yep.
them have also expressed concern about the plan to accelerate tax remittances. How do you recommend they navigate all of this during this time?
So there are two other things that happen in January. One is the paid medical and family leave program starts in Massachusetts, right, which was passed by the legislature and we signed a little over a year ago, and the minimum wage goes up. So there are some increases for employers generally that are coming in January, although the PFML piece comes with a benefit to workers that I think most people we're anxious to see us put in place here in the Commonwealth going forward. With respect to the sales tax acceleration, I would just say about that, this is not 1965, okay? It's 2020. And more transactions that take place between consumers and businesses take place electronically, online, and instantaneously. And in many cases, all the issues associated with how that information gets booked and coded happens at exactly the same time the transaction happens. And the sales tax acceleration piece, which would basically mean people need to pay, for all intents and purposes, at the point of the reconciliation of the transaction, instead of 30 or 45 days later, only applies to big businesses. And those big businesses, for the most part, have benefited more than practically anybody else with respect to their growth in revenue and profit and everything else since the beginning of this pandemic. And the idea that they would continue to carry this float, which for all intents and purposes is sales tax owed to the Commonwealth, just doesn't make a heck of a lot of sense in the 21st century with all we know about how those transactions get booked, reconciled, and entered at this point in time, which is almost completely an automated process for the vast majority of large companies. And this does apply just to large companies. Thanks, everybody.
Thanks, Governor. Do you have concerns about the numbers coming from schools this week that were higher than they have been since reporting began as numbers of COVID cases? Any thoughts as to why or what?
Well, it comes back to the issue associated with the amount of COVID in the communities generally. There's still no real evidence that spread's taking place in schools. And remember, the vast majority of the reporting that's done is about people calling to say that so-and-so won't be in school because they've tested positive. And it's still a fraction of the positivity rates that you see in communities and across the Commonwealth generally. School is still a much safer place for kids to be than most other places in the community. In fact, the CDC just put out a report that said among kids who've gotten COVID, they were more likely to have been at play dates, parties, weddings, or funerals. Those were really the places where the CDC said you primarily saw that a lot of these kids who got COVID had been. School was not one of them. In fact, school was on the other end of that calculation.
Governor, the U.S. Attorney's Office just tweeted that a former employee of the Mass Department of Unemployment Assistance and her husband were arrested on federal fraud charges arising from their claims for the PUA. Do you know anything about that at all?
I don't know anything about that, but I can tell you that, we've been in constant contact with federal authorities, the FBI, state police, U.S. Attorney's Office, practically every day since all the issues associated with fraud that were attached to the unemployment insurance program dating back to March, and there have been arrests and there have been recoveries as a result of the work that we've done together over that period of time. I don't know much about that specific case, but I can tell you that I would guess that every unemployment operation in America has been in pretty close contact with the feds and with other folks in federal law enforcement and state law enforcement around issues associated with fraud on a very regular basis since this was first deemed to be a problem back in the spring. Thanks, guys.
Thank you.